Recording for this meeting will be available on the CCDPH Grants website. Lou from our team is going to drop the link to that webpage in our chat. So just a bit about who we are. The Cook County Department of Public Health is the state-certified local public health department for suburban Cook County. We serve 2.5 million people. As many of you know, suburban Cook County is a large and politically complex region. We have over 120 municipalities, 140 school districts, 88 park districts. And as a result, CCDPH, the Cook County Department of Public Health, has always centered partnerships in our work. We work with community-based organizations, local government, schools, and many other partners to promote community health and health. I wanted to give a little bit of background on our why. Cook County Department of Public Health has recently is about to release Building Healthier Communities 2030. Building Healthier Communities 2030 is the Public Health Department's community health improvement plan for suburban Cook County. This improvement plan was informed by surveys with thousands of suburban Cook County residents and conversations with community organizations and partners. It's our roadmap to advance health equity, improve health outcomes, and address the social and structural factors that influence community well-being. The plan identifies mental health and substance use as one of 3 priority areas, and Cook County Shop Talk helps advance Building Healthier Communities 2030, and it's grounded in the health department's commitment to advancing health equity and addressing disparities in behavioral health outcomes, in strengthening community partnerships and increasing access to prevention resources, and elevating youth voice in community-led solutions. So Shop Talk supports municipalities in creating safe spaces where youth and young adults can talk about mental health. CCDPH is grateful for the support from a 2026 budget amendment from Commissioner Tara Stamps, which was inspired by the success of mental health conversations in barbershops and hair salons. The focus of today's conversation is on Cook County Shop Talk, but the health department has also recently released 2 other open calls. If you're curious to learn more about those opportunities, please check out the grant opportunities webpage that's in the chat. I'm going to pass the mic to Camille Johnson, our grants administration manager, and Camille and our team members are going to share more details about background for the grant and about the open call. Thank you.
Thank you, Hannah. Mental health challenges are affecting many South suburban youth with disproportionate impacts on youth of color. Statistics show that in 2022, depressive symptoms among high schoolers were reported by 37.4 Hispanic students and 35.5 of non-Hispanic Black students. Comparatively, 29.1% of non-Hispanic students were listed. There are numerous social and structural factors, including trauma, poverty, housing instability, and limited access to care, which contribute to these disparities. And trusted community spaces such as barbershops and salons can help connect residents in Black communities with mental health education, support, and resources. Youth and community partners have identified a need for safe, welcoming spaces where youth. At this time, I would ask that if your phone is off mute, you just kindly mute. Thank you so much. Youth has showed that they want these trusted spaces. Through this funding initiative, we will be supporting that. For the scope of service of this grant, these dollars will be used to support culturally responsive youth mental health conversations and safe spaces for youth ages 12 to 24. We will focus on engaging youth of color in suburban Cook County communities with elevated mental health needs. For this grant-funded, municipalities will host the following activities. There will be community-based mental health forums and engagement activities for youth and young adults 12 to 24. We're asking that you utilize trusted community spaces such as barbershops, beauty salons, community centers, schools, and other youth-serving locations in order to have events. You will engage youth in planning, implementation, and get their feedback. We want you to collaborate with community-based organizations and behavioral health providers to strengthen impact and connect youth and families to behavioral health services. We are asking that programs prioritize youth of color and communities with the highest need for behavioral health support. For eligibility requirements, eligible applicants must be incorporated municipalities located within the South and West geographic regions of suburban Cook County. The following jurisdictions are not eligible because they are served by their own state certified health departments: Chicago, Evanston, Oak Park, Skokie, and Stickney townships. For this funding, community-based organizations, nonprofits, and other behavioral health providers are critical partners. However, they're not eligible to apply independently for this grant opportunity. You must be a municipality. When we make our funding decisions, we will prioritize communities where there's a greater need for behavioral health resources. Additional requirements, municipalities may submit joint applications. One municipality must serve as the fiscal agent. Applicants must demonstrate capacity to manage grant funds and program activities, and they must establish partnerships necessary to implement the proposed program. An example of that will be partnering with a behavioral health provider. Next slide. For partnerships, when applying for this grant opportunity, you must submit letters of support demonstrating your partner's ability to provide behavioral health services. So a letter of support from a behavioral health advocacy organization and/or a behavioral health treatment provider to provide mental health education to youth and young adults of color. This letter should describe the partner organization's experience in hosting trainings or presentations on mental health for youth and young adults in the last 2 years. There also should be support in terms of partnership for mental health referrals. So a letter of support from behavioral health organization that would accept mental health referrals for assessment and support. For this letter, it should include the partner organization experience in providing mental health to youth and young adults of color, and also their method for tracking referrals to mental health and social service supports. Examples would be housing, food, employment, and other things to address social determinants of health. For successful implementation of this program, you will need collaboration. The partner organization can be the same as the organization providing mental health education. Only one letter of support is needed if the same organization will provide mental health education and also mental health treatment and support services. Include in that letter any requested details for both activities. Next slide. For award information, there's a total of $475,000 available. There will be up to 4 awards total. There will be 2 awards in South Suburban Cook County and 2 awards in West Suburban Cook County. The maximum award for this grant will range from $118,750 to $237,500. Project period 12 months. And Cook County reserves the right to adjust award amounts based on the proposal quality, demonstrated need, and program capacity. In terms of funding, it will be provided through a combination of reimbursement and advance payments in accordance with Cook County grant policies and the organization's cash flow needs. Advance determinations will be based on the organization's need, past fiscal and risk assessments, and compliance with reporting requirements. The anticipated start date was around mid to late September. This is a 12-month grant. At this time, I will pass it over to my colleague, Isaac Marufo. He's our community engagement manager, and he will discuss allowable grant costs and reporting and metrics. Thank you.
Thank you so much, Camille. Hello, everyone. In this section, I'll provide an overview of the eligibility requirements for the Shop Talk open call, including some examples of eligible activities and potential areas of focus. One example of an eligible activity is hosting youth mental health forums in community-based settings, such as barbershops and beauty salons that align with the Shop Talk model. Eligible activities may also include community conversations and mental health awareness events that address the behavioral health needs of youth and young adults of color. Another example is facilitating youth leadership in advisory activities that incorporate culturally responsive and trauma-informed approaches, empowering young people to actively participate in shaping behavioral health initiatives. Organizations may also conduct outreach and engagement campaigns, as well as partner-led educational workshops designed to increase awareness of behavioral health resources and reduce stigma. Finally, Eligible activities can include behavioral health resource navigation and referral coordination, connecting youth and young adults to treatment services, and other supportive resources within their communities. When discussing allowable costs, it's important to remember that the grant funding can be used to support a variety of program activities. Examples include staff time dedicated to community engagement and outreach, venue rental cost, training materials and supplies, food and refreshments for participants, youth participation incentives and stipends, and community education efforts that align with the goals of Shop Talk Open Call. One note to keep in mind is that capital improvements and construction expenses will not fall under allowable costs for this grant. In general, all costs charged to this grant must be reasonable, necessary, applicable, and allowable under 2 CFR Part 200, also known as Uniform Guidance. In other words, expenses should be essential to carrying out the work of this grant, permitted under federal regulations and the terms of the award, and appropriately assigned to the grant. All expenses must be well documented. This includes maintaining invoices for purchases, proof of payment such as receipts, staff timesheets, or allocation logs that support how costs are distributed. One important concept to keep in mind is proportion cost sharing. An example is if an employee whose salary is charged to this grant spends only 50% of their time working on grant-related activities, then only 50% of their salary should be charged to this grant. Similarly, a cost cannot be charged as a direct expense if it is already being covered through the organization's indirect cost. The maximum indirect cost that can be charged without a negotiated agreement is 50% of monthly expenditures, if applicable. Finally, please note that CCDPH does reserve the right to request additional budget justification or supporting documentation and will make the final determination on the allowability of all costs. For this next slide, we're going to be covering reporting requirements and key performance expectations for funded partners. Funded organizations will be required to submit both programmatic and fiscal reports on either a monthly or quarterly basis, depending on their assigned organizational risk level. These risk levels are determined through an annual organizational risk assessment. In addition to reporting, funded partners are expected to track expenditures and program outcomes in accordance with the Cook County guidelines. Partners will also participate in program monitoring, required check-in meetings, and evaluation activities, with the frequency of these activities also determined by their risk levels. Funded organizations must maintain complete and accurate records, as all grant-related documentation is subject to review and audit by Cook County. Lastly, it is important to emphasize that compliance with reporting and performance requirements is a condition of funding. Failure to meet these requirements may result in corrective action, and if the issue is not resolved, could ultimately lead to the termination of grant funding. With that said, I'll pass it along to our monitoring and evaluation coordinator, Monica Chen, to provide a Smartsheet overview.
Thank you so much, Isaac. So now we will be reviewing how you can submit your application for this grant opportunity. All applications will be submitted through a Smartsheet form, and my colleague Lou has just dropped that into the chat. So please ensure you're completing all required fields and uploading all required documentation before submitting the form. At the top of the form, we do include a list of required documentation, including your program proposal and your program budget. And we ask that you use the templates provided in this form to complete those two application documents. Unfortunately, you cannot save your form as you go along, but we have designed the application so that most of the preparation happens before you enter information into the form through these templates that we've provided at the top. And please ensure that all of these required documents are finalized and saved before uploading and filling out the Smartsheet form. Here we have a snapshot of the form, which has multiple sections to complete. All required questions are marked with an asterisk, including the contact details of the person submitting the form. If the person submitting is not the lead of the municipality submitting the application, please include their contact information as well. And if applicable, we do ask that you list any additional municipalities on the application form and who the fiscal agent would be. And lastly, on the form, we do include a checklist to ensure you are including all of the required documentation for the grant opportunity. And please make sure you're using clear file names when uploading so that we can identify each application component when reviewing your application. And also we ask that you check off all of the required boxes to confirm you uploaded all of the attachments and acknowledge the requirements for this funding if awarded. Before submitting, we also strongly encourage that you review all the fields and attachments on the application, as well as check off the very last checkbox in the form that says, send me a copy of my responses, just so that you have a copy of your submission after clicking submit. And now I'm going to pass it back to our Grants Administration Manager, Camille Johnson.
Thank you, Monica. At this time, I will discuss the required application documentation. The following documentation is required to submit a completed application. You will need to submit a W-9, a certificate of good standing from Illinois, program proposal, a template is provided, program budget, a template is also provided, and a letter or letters of support. You can see the program proposal template for more information on the letters of support. And another reminder, please complete the Smartsheet form and upload the required attachment before you hit submit on your application. CCDPH reviewers, I'm sorry, next slide, thank you. CCDPH reviewers will assess how well each application addresses the goals of Shop Talk. All proposals will be evaluated through a competitive process. Proposals will be evaluated based on, but not limited to, the following criteria: demonstrated community need, quality and feasibility of the proposed program model, capacity of the organization to manage and oversee fiscal, administrative, and programmatic aspects of the program, equity and community voice, and budget clarity and cost reasonableness. Each section of the application does contribute to the overall score. A strong application demonstrates vision and implementation. Please be specific. Answer each question thoroughly and ensure all the requested documents align. At this time, I'll pass it over to Isaac to discuss how to submit questions related to the application.
Thanks again, Camille. All questions regarding this open call should be submitted via email to buildinghealthiercommunities@cookcountyhealth.org. Responses to questions submitted by email will be posted as updates on the webpage. In addition, CCDPH will post responses to questions received through the Building Healthier Communities email address and on the CCDPH grants webpage according to the response schedule below. As a reminder, the application deadline for this open call is July 30th, 2026. And with that said, I'd like to thank you all for your time and attention. I'll now pass it back over to our Director of Community Behavioral Health, Hannah Kite.
Thanks so much, Isaac. So we're going to start the Q&A portion of our information session today. We're going to start with 2 questions that we received over email and respond to those questions. And then please feel free to start dropping questions into the chat, and we'll go through and start responding to those after Camille reviews the responses so far.
Thank you, Hannah. These were questions that were submitted via the Building Healthier Communities email address for 7/6/2026. The question was, my organization has been looking at the Shop Talk grant and have a question regarding the application requirements. Our organization is based in the city of Chicago, but partners with the South Suburban Mental Health Organization to expand the impact of culturally responsive art therapy program. We are looking for clarity on if submitting a joint application allows for us to qualify or if our partner organization will need to be the lead. Any insight on this will be greatly appreciated. For response, the Cook County Shop Talk lead applicant must be an eligible incorporated municipality located within the South and West geographic regions of suburban Cook County, excluding Chicago, Evanston, Oak Park, Skokie, and Stickney Township, who have their own health departments. If your organization partners with an eligible municipality that serves as a lead applicant and fiscal agent, your organization may participate as a partner organization providing culturally responsive art therapy and behavioral health services under a contractual agreement supporting the proposed program. The youth and young adults participating in the program must be residents of South and West Suburban Cook County. Next slide. The next question was submitted. Is GATA certification required? Response. GATA certification is not required for this funding opportunity. However, applicants must demonstrate strong fiscal and administrative capacity to manage public funds in accordance with the Cook County grant policies and procurement standards. This time, I'll pass it back to Hannah to address any questions shared in the chat.
Thanks so much, Camille. So we have one question from Vishnu. Vishnu asks, must the youth engagement and mental health partners be located or serving the municipality's suburban area, or can a Chicago-based youth organization partner with a suburban municipality? So yes, Chicago-based youth organizations are eligible, but as Camille mentioned in response to the previous question, the youth and young adults served must be suburban residents. Precious asks, can more than one organization apply with one municipality? Yes, more than one organization can work with a municipality to submit an application. Got one more question that I think is being added. So Pastor Keish Coleman asks whether the funding is limited to municipalities and if how a nonprofit or faith-based organization would fit into this grant funding. Pastor Coleman, this funding is limited to municipalities, so we would encourage you to reach out to your local municipalities to see if they would be interested in partnering on an application together. Feel free to come off mute too if you'd like to ask your question that way. Any additional questions, we'll field them.
I have a quick question.
Sure.
How would a faith-based organization find out if they're in good standing with Cook County?
For this particular grant opportunity, we're going to be looking at good standing for the municipality because only municipalities can be the fiscal agents. I've got one more question in the chat. Is the preliminary list? Thank you, Sheila. Is there a preliminary list of municipalities in Southwest Suburban Cook County? No, we don't. We do not know who is interested in applying for this opportunity. I am going to drop one link that I think might be helpful. This is a list of suburbs served by the Cook County Department of Public Health, and so it organizes suburban locations or suburban municipalities by the south and the west areas. So this will give you a complete list of different municipalities in those two areas. Have any more questions? Again, please feel free to come off mute or drop questions in the chat. We'll give it one more minute.
Hi, I had a quick question. Can you hear me?
Mm-hmm.
Yeah, so I was wondering, in terms of the community partners, is this restricted to like clinical mental health organizations, or could like a non-clinical, like maybe youth
Yeah.
engagement?
We're requiring 2 letters of support or 2 partnership. The first, for the mental health education piece, that can be a non-clinical partner. For the second, partnership, so referrals to behavioral health treatment, that does need to be a clinical partner. Any other questions? Going one, going twice. Thank you. Thank you so much for joining everyone today. We will be responding to any questions. If you have any additional questions after the information session today, please send those through with the email, and we'll post the responses to the website every week. Isaac shared the schedule, but that schedule is also available on our grants webpage. Really appreciate your interest in the opportunity, and thank you, Lou, for also adding the email address to the chat. Thank you so much for joining us this afternoon.